So if you're dealing with neck pain that is usually accompanied by a sense of stiffness and occurs with movement, so either rotation, looking up and down, or tipping the head side to side, and your pain tends to be kind of in the center of the neck, or maybe just along one side, but still in the region of the neck, then you're probably dealing with neck pain with mobility deficits. And what that means is that you are most likely, or research shows us that you're most likely to respond to a combination of manual therapy and specific exercises. So manual therapy is a treatment that is delivered by a professional who has had some training in hands-on skills. So for example, an orthopedic physical therapist likely has some manual therapy skill. And these techniques could vary from massage, other soft tissue techniques like dry needling or Graston, which is an instrument-assisted soft tissue technique, or joint mobilization, which is basically pushing on joints with, the therapist will push on your joints with their hands to try to loosen up the area of restriction, get you moving better and pain-free. So that's the first part. And the second part is exercise. So in this video, I'm just gonna show you a couple exercises that I find to be really effective in just getting that first part of mobility going for a lot of people who have that neck pain with mobility issue. So the first exercise is to get range of motion. And I call this the 3-finger rotation exercise. So 3 fingers, you take your pointer finger, your middle finger, and your ring finger. And you take your ring finger and you put it on the notch of your sternum. So right kind of at the bottom of your throat, like that. And then you're gonna tuck your chin down to touch your pointer finger. So you're gonna keep that level of chin tuck, and you're gonna sweep your head side to side. Each time you come back through the center, grazing your chin across your fingers, which ensures that you keep the appropriate amount of bend in your neck or flexion. And now if you can't quite get there, you can use 4 fingers. You can just go as close as you can. This should not create any pain. It's essentially a way to loosen up the portion of your neck that does most of the rotation. So that's way up high. And by bending all the way, you take that rotation out of this lower part of the neck and you just allow that upper part to move. Okay? So that's your 3-finger rotation exercise. I would recommend starting a pretty low amount, maybe 10 rotations per side per day, just to make sure that it doesn't create any aggravation. The second exercise that is effective for many people who have mobility deficits with neck pain is a stretch for all the muscles of the neck. So to do this stretch, you're going to turn your head so that your nose points towards one shoulder, and then you're going to tip your nose down, kind of like you're trying to smell your armpit here, and you're going to reach for the base of your skull and pull your nose down towards that armpit. So you should feel a nice stretch across here. Again, it shouldn't be painful. You can always take your hand and hold on to the base of the chair that you're sitting on for a little added traction. And then you're going to take your nose and you're going to turn the nose without moving the ear, so you're still in a side bend, and turn it up towards the ceiling to change the location of the stretch. So you'll feel it a little bit more towards the front here, targeting this big muscle in the front. Okay, you'll want to do that to both sides. Just turning as much as you can comfortably. None of this should be forced. Reaching for the base of your skull, pulling the nose down towards the armpit, creating traction with the other hand, if that feels good to you. And then about halfway through, so about 30 seconds in, turning your nose up towards the ceiling and keeping that side bend. Okay, that stretches muscles like the upper trapezius, the scalenes, the sternocleidomastoid. But really all you need to know is just that you feel like there's kind of a therapeutic benefit. It should not be painful during or after the stretch. And then the final exercise that I think is really effective, or I found is really effective for patients with neck pain, is a foam rolling technique. And I'll show you that in the next video.